Mr. John, with the diagnosis of polytrauma, needs a 12 French triple lumen catheter, which is planned to be inserted in the right internal jugular vein for administration of fluids and vasopressors. And the proposed duration will probably around 10 to 12 days. Mr. John, we'll be putting a catheter inside your right side of the neck. It is for administering some fluids and drugs. And we'll try to make it as painless as possible. We'll be giving some anesthetic, local anesthesia, and we'll be trying to make it very painless. You will not feel pain, but you will sometimes you'll feel being touched. So is the consent form ready in the... Okay, we have obtained the consent form.
Yes.
Does the patient have latex allergy? Or, okay, the patient doesn't have lignocaine allergy also? No. Okay. And then I'll have to do a pre-procedural check ultrasound. Can you give me that linear flow? Okay, please put some jelly. Okay, I'm just placing the probe over your neck. Okay, visualizing the vein. The vein appears to be patent. And then, okay. I'm going to start the insertion of right internal jugular vein catheter for Mr. John. The site is being assessed. The site appears to be normal for the procedure. Placing the patient in slight Trendelenburg position with spacing towards the left side. Assemble all the equipments which is needed. The CVP set, the ultrasound machine, and all the other equipments needed for the procedure. And there should be an X-ray of the chest that should be done after insertion of the catheter. I'm currently going to do the hand hygiene. So we'll start the procedure now. Put some chlorhexidine solution. Okay. Give me local, the needle and the local. Another needle for giving the local also, okay? Oh yeah. Saline also for flushing. John, I am going to prep your skin with the disinfectant. So, chlorhexidine based disinfectant is being used to prep the skin.
Large sterile drape is used for covering the patient. And will completely cover the patient.
Please put the central line set also.
Okay, now we shall start to do the procedure by giving local anesthetic. Put some jelly, please. Mr. John, I am going to give you some local anesthetics so that you will not know the pain. Local given, and then starting the procedure. Yeah, I have pricked the skin. It is in the vein. I have aspirated. Blood is coming. Now we have to do the guide wire insertion. Please hand me the guide wire. Okay, whatever. And then removing the needle. Putting a nick with the knife and then using the dilator. Dilator is used to dilate the site. Then finally putting the catheter. Now removing the guide wire. Hand over the suture, please. Suturing the CVC onto the skin. Hand over the abstainer to me. Flush it and we will now connect the external to one of the pots. The procedure is over. We will do hand hygiene. Patient needs administration of an IV drug, so we are cleaning the pot with 70% alcohol swab before giving the drug. Cleaning for 10 seconds. Giving the drug. And after giving, clean the pot, scrub the access pot with 70% alcohol for 10 seconds. CVAD dressing is changed after 2 days or when clinically indicated if there is visible contamination, loose or dislodged dressing, presence of infection or inflammation, or scheduled catheter flushing. Okay. Explain the procedure to the client.
Mr. John, we will remove the soil dressing and we will put another one. Okay.
Hand hygiene performed. Remove the existing dressing by lifting the edge. Discarded onto the yellow bucket. Assess the catheter site for skin integrity. Remove the gloves. Hand hygiene. Sterile gloves are worn. Chlorhexidine is used to clean the area by back and forth motion for 30 seconds. The area is being cleaned with chlorhexidine solution for 30 seconds. Now we can apply the transparent dressing over the catheter insertion site. Semi-permeable transparent dressing is inserted over the catheter site and label the dressing with the date. Label with the date. Change the transparent semi-permeable dressing every 7 days or sooner if clinically indicated. If there is visible contamination or soiling, loose or dislodged dressing, assessment of insertion site for infection, inflammation or complications. Removal, the CVAD removed when clinically indicated. For Mr. John, he does not require any vasopressor now, so it is time for removal of his CVAD. During time of removal, nurse gives the Trendelenburg position. The position is Trendelenburg position, and the patient is asked to hold his breath. Hold the breath. Okay. Now remove. After removal, pressure is applied to the site until hemostasis is achieved. and then an occlusive dressing is applied over the site. Catheter is inspected for intactness after the removal, and if removed due to suspicion of infection, a tip is sent for culture.